3 nurses who received a Sinovac vaccine are now in quarantine after testing positive for COVID-19. Infectious diseases specialist Dr. Ronjin Solante explains an infection is still possible if the person had the virus a day or two before getting vaccinated or when exposed to the virus before the antibodies kick in.
Unang-una, we don't do screening for RT-PCR prior to vaccination. So it could be possible that when they were given the vaccine, nag-incubate na yung COVID infection sa kanila. Is it something that is alarming? No, because the vaccine will still be given until such time na wala na siyang symptoms.
Filipino Nurses United President Maristela Abenojar says the nurses got the Sinovac vaccine on March 1st and even administered vaccines or assisted in the immunization program. They were swabbed after a week and tested positive on March 9. They are asymptomatic.
Hindi naman natin masasabi na ito ay dahil sa Sinovac or what.
Dr. Solante explains that a person will only get some protection from the virus on the second week after vaccination. That's when the body would have started producing enough antibodies to help fight the infection.
On the day 14, dun pa lang mag-umpisa ka mag-produce ng antibody. So that means that from 14 days to 28 days na bago ka sa second dose, you will already have an antibody. But that antibody is not yet the maximum protection. You need the second dose for you to have a better protection.
Almost 216,000 frontline health workers got the first dose of Sinovac and AstraZeneca vaccines. The Filipino Nurses United is calling for paid leave if they experience any side effect which could hinder them from working.
Yung mga nurses na willingly nagpabakuna ay nagkakaroon sila ng mga symptoms na hindi nila kayang magtrabaho. Hindi sila paid. Sila ay inabsent from their work. And what we request sana, although of course ina-expect namin, dapat automatic yun. Dapat ang mga nurses na nabakunahan ay naka-leave at least man lang 2 days kasi they experience fever at iba pang symptoms.
Meanwhile, the Philippine Infectious Diseases Society for Obstetrics and Gynecology says pregnant women who are at high risk of exposure to COVID-19 infection, as well as lactating mothers, may receive a COVID-19 vaccine despite limited studies on its safety and efficacy. But this is still upon doctors' assessment and should only be offered to pregnant and breastfeeding women at high-risk groups such as frontline health workers and uniformed personnel. They recommend it during the second or third trimester of pregnancy.
The vaccine component doesn't really go into breast milk. So pwede po magpakunahan ang kapapanganak lang at nagpapasuso or nagpapabreastfeed na mother.
Doctors say those who have just given birth may also be vaccinated against COVID-19, but they must wait 2 weeks after receiving a different type of vaccine like anti-tetanus or flu shots. Caroline Bongkin, CNN Philippines.